As the country continues to experience a dengue outbreak, there are some Jamaicans who are still confused about the symptoms of the virus and exactly what they need to do if they contract it. So in this evening's edition of the Health Report, public health specialist Professor Winston Davidson takes a look at the issue. TV Day's Shamela Pullen reports.
Health Report. Dengue is a mosquito-borne disease caused by a virus. The virus is transmitted by the bite of an infected Aedes aegypti mosquito. Symptoms for dengue typically begin 3 to 14 days after infection.
If there's sudden onset of fever, high fever, and of course, severe headaches, there is what we call retroorbital pain, pain behind the eyes. Fatigue, you feel weak. Sometimes you have severe joint pains and muscle pains. And occasionally you can have some nausea, feeling that you want to vomit. You may even vomit. Occasionally you may get a skin rash.
If you're going to treat any of those symptoms at home, there are some medications you need to avoid.
Simple analgesics like Panadol or acetaminophen. These are drugs, but you must not take drugs like aspirin that will cause bleeding or any other drug that would prolong, that have what you call affect the blood in a way that it will cause excessive bleeding.
However, public health specialist Professor Winston Davidson says those are just to relieve the symptoms temporarily. Therefore, it is best you visit the nearest public health facility or your private doctor immediately. In terms of natural remedies, Professor Davidson says he does not see a problem once it is in keeping with a healthy lifestyle.
I'm talking about good nutrition, physical exercise, stress, coping with stress, getting proper sleep, and having an environment around you, right, that is clean, that doesn't have a lot of garbage or other disposal of waste in such a way that it causes the multiplication of the mosquito.
With our health report, I'm Shamela Pullen wishing you good health.